Practice.
Sinus infections are one big reason people go to the doctor, but sometimes medicine doesn't help. Tonight, in a special Hometown House report, WDBJ7 goes into the OR to see a surgery that's changing lives and helping patients breathe easier again.
Your mommy's little boy.
Kaitlin Ramey is newly married, but instead of feeling great, she was feeling lousy from sinus troubles.
I was getting sinus infections at least once a month, so really they weren't going away.
This went on for months.
I felt terrible for pretty much a solid year. You know, it really affects your sleep when it's very difficult to fall asleep when you can't breathe.
Ramey's allergist referred her to Dr. Brian Gross, who after an exam and CT scans recommended Ramey undergo endoscopic sinus surgery. WDBJ7 went into the OR to watch this type of surgery up close with a different patient. Right now I'm in the operating room at Lewis Gale Medical Center where Dr. Gross is performing the procedure on a 61-year-old man. The patient is under general anesthesia, but will be able to go home today. This patient, like Ramey, has struggled with sinus troubles for months.
This man has had chronic sinus disease, over a year of drainage from his nose, nasal congestion, tooth pain.
Dr. Gross uses an endoscope, a long tube with a light and video camera on the end to see into the patient's sinuses, those hollow cavities in the skull. The image is seen on the screen nearby.
There's natural openings, natural holes into all of our sinuses. But when you have problems with inflammation and infection, those holes get blocked.
And that can lead to infection and chronic problems. With the endoscope in his left hand, Dr. Gross holds a tool in his right hand to widen the natural openings. The surgeon is guided not just by the image from the endoscope, but also from CT scans of the patient's anatomy that are seen on another screen.
So right now I am getting ready to enter one of the openings into the maxillary or the cheek sinus.
After about 45 minutes, this patient's surgery is done and it's gone well. Dr. Gross says the procedure is best for people with chronic sinus problems where medications just aren't working.
Some of the most notable symptoms are nasal obstruction, so inability to breathe through the nose, drainage out of the nose, either coming down the front or down the back of the throat. They'll also have facial pressure and pain.
Yeah. Where's your brother?
Kaitlin Ramey's surgery was in November. She felt results right away.
It was almost immediate. It was awesome.
And now, 6 months after surgery,
I feel a million times better. I can breathe normally.
Now, this surgery is less invasive than sinus surgeries of the past. Research shows 95% of patients have improvement in the quality of life. Fewer than 1% have complications. Now, as for that patient, that 61-year-old man in the OR who so kindly let us be in on his surgery, Dr. Gross says he's feeling 100% better since surgery.
It's going to be a little loud.